So just as a reminder, we are starting the meeting. I'm admitting everybody who is in the waiting room. Good afternoon, everybody. We are just admitting everybody from the waiting room. It does take a couple of minutes for that to occur. And so while that's happening, just as a reminder, my name is Dominic Zerlo with the New Mexico Department of Health. I'm the Center Director for Medical Cannabis and Psilocybin. And this meeting is being recorded. And this is the Propagation Committee meeting with Chris Peskuski as the chair. And with that, I will turn it on over to you, Chris.
Thank you. We just started and I saw Greg has his hand up, but as you know, we usually start these meetings with 30 seconds of silence just to try to center ourselves and create a small container of calm in a world full of chaos. So you'll stick with me for 30 seconds. All right. Thank you, everyone, for that. And sorry to pick on you, Greg. We'll get to questions in a minute, though. I called this meeting just so we can all gather information about the next step with the rules hearing. And so we can maybe talk about some of the things that we've seen individually so that we can collectively, I guess, advocate for them at the rules hearing. But a lot of this is I just wanted to get people to understand how this process is moving forward and how they can continue to be involved and what the next steps are. So with that said, would you like to give a program update, Dominic?
Sure, absolutely. As everybody knows, so the rule hearing is going to be on Friday, April 24th, starting at 9 a.m. It is a hybrid meeting, so people are welcome to come in person. It will be held in the auditorium at the Runnels Building in Santa Fe. That's at 1190 St. Francis Avenue in Santa Fe. Or you'll be able to register and join virtually. And so for people who are not able to travel or be there in person for a variety of reasons, you can still join in and participate. And so really that's our big aspect of what's going on right now. The program has been meeting, and I've announced some of this and some of the other. Forgive me if I am duplicating in other meetings, but we've been meeting with HCA with regard to potential billing ability during sessions and what exactly that would entail and what would and would not potentially be covered. That's going to be very key and important with regard to as far as licensures for various licensed healthcare providers, such as licensed counselors, therapists, social workers, MDs, et cetera. And so we're working with them with regard to that there'll be more information in the Education and Training Committee. We are actually participating in a tribal listening session, which is happening next week on the 22nd and 23rd, where we'll be presenting to and hearing from tribal administrators with regard to the psilocybin program. And so helping to move forward and ensuring that there's a safe place for people to provide information. And in addition to that, just the number of committee meetings, there's quite a few coming on up, and we'll put those in the chat here in just a minute. And then otherwise, I think everything else is around the hearing. And so, Chris, would you like me to just dive into sort of what the hearing entails and how that works and that aspect, or are there other items you want to talk about first?
No, those were going to be my next questions, actually. Like, what do people expect? Are there going to be time limits? Would they better be be better off putting in longer comments. And before we move to that, though, I did have one question about the tribal listening session. Is that a closed meeting or is that open to the public as well?
That actually was by invite for the tribal administrators that work through or that has come through our Office of Tribal Liaison. So that is not open. I'm not sure who else is invited, but I do know it's tribal administrators so that they can start participating. We do anticipate having additional public sessions, but limited for tribal members to ensure that there are safe spaces.
Absolutely. I agree wholeheartedly. And hopefully Desbaugh gets to go. The only thing I'll add to that. So I believe Jorge has posted a copy of where people can find the notice and the text of the proposed rules. It's at http nmhealth.org//about/cmo/rules/ and here he just put it in the chat again. Thank you. And so that's where you can find it. What do people expect when they get there?
Okay. So essentially what happens with the rule hearing, and this, by the way, we've actually had it in various newspapers. We've talked about it in other meetings with regard to it, and we do anticipate and actually encourage for there to be public comment regarding it. Now, the hearing officer usually will set a time limit with regard to public comment. Each individual usually getting a set amount of time. And that time is often either 3 to 5 minutes. So just be prepared for that aspect once the public comment section of it, the hearing starts. But the way the hearing usually or the way the hearings are structured is once the hearing is called to order and is made public, so everybody let in through the virtual link and for the people who are present, is the hearing officer has some formal aspects that they have to go through and announcements, things like that. And then the next step is that the hearing officer will ask for the program to provide any potential changes and a brief overview of the rules from when they were published. Now, one of the things that does occur in the time frame between when we published the rules. Now, I should make sure that everybody understands publishing them just means making them public. It's not the final rule set. Promulgate is the term that is used once they get into effect. And so for the once they were published, we have been receiving in some public comment on it. And with that, there are mistakes that we made in the rules, slight changes that need to happen, other areas or sections that need to be addressed a little bit more. That will all be announced and discussed at the beginning of the rule hearing. So what will happen is either myself or Jorge will go through all of the different potential changes from what was originally published to what is being presented at that time. We are working, and so we are working as public comment comes in, and I know there's been some that we've received, especially in the last couple of days, to compare it to the rule and see, does this make sense? Does this change, for example, in wording, or what somebody has proposed as a difference in process, procedure, etc.? Does that make sense, and do we need to look at changing it? And so those processes are going on right now. And that will all be discussed and announced at the beginning of that rule hearing so that everybody who is there knows. So if a part, for example, say there is a particular definition that that you think, oh, that should change. And if you hear in the very beginning of the hearing that, oh, we've actually changed that definition because we already got that feedback, you can then modify your public comment. If you're doing it verbally during the hearing, you can modify your comment so that you have time to focus on some of the other examples. So that way you understand and can hear what are the differences that have occurred from the publication until the hearing itself. Now, and then once that portion is done, and all of these are submitted as exhibits. And so all of this becomes a part of the record for the hearing. And then essentially, the vast majority of the meeting is usually public comment. And that is the point where people and individuals can go ahead and turn around and express their thoughts, opinions, and ideas with regard to the rules. Now, some of it, I will be very honest, during previous rule hearings, we could quite often hear about things that just are not possible under a particular statute or are outside of the purview of the department. And that's perfectly fine. Just realize that there may be items that we don't have any particular way to change because they are in statute or outside of our jurisdiction. I hope this all makes sense. I'd like to stop right now just to make sure and see if there are any questions about this so far. I'm not seeing any hands. Okay, well, I'm glad that I'm explaining it well. But if people do have questions about it, please don't hesitate. If you think about it in the next few minutes during this meeting, please also don't hesitate. Now, the other part I just want to talk about, and this seems to be something that, again, as we've talked about it in some of the meetings, but it seems to be a part that people are a little confused and have kind of overlooked. And that's okay. There's a lot going on with this, and so that's easy to do. And the main part about that is some people have made comments that they want to change the definitions for things like the practitioner, the guide, and all of that. And what I just want to make sure is clear is those aspects that really are about the therapy and the administration side are actually there as placeholders because they are mentioned in this rule because, for example, when the psilocybin is transported from the cultivator to the practitioner or the approved location, there had to be essentially a placeholder definition. As some of the other committees, especially training and education, where they're looking at what levels of licensure for practitioners and clinicians and those sort of things, where those are going to be, those definitions are going to change because that is a part of that purview of that committee. But because those individuals are mentioned within this rule, we had to have placeholders. So if you're looking at some of those definitions, please do still make the public comment because that public comment can actually go to the committee as far as looking at for the next set of rules on what gets changed on it. These rules really are focused on the aspects that surround cultivation, transportation, and testing. So if the other part is that you have a lot of time, you have a lot of other things and priorities in your life, which I know everybody does, and you want to focus in as far as the rule, the parts to look at and really take more time on, those are the three areas to really focus on. And again, because some of those definitions are there as placeholders. But if you're not sure which ones, please go ahead and provide that comment because, again, that can be very useful still with regard to the other committees as they look at those aspects of treatment and education and training. And I hope that part's making sense. And that primarily, by the way, is just within the definitions. Any questions so far?
No, I think that helps a lot, Dominic. I know there's been some confusion about that and why those definitions were put into place because we hadn't really decided in the advisory board about that yet. So that's very helpful. Please forgive me. I'm on a 2.5-day fast, so I'm about 3/4 of the way through it. My brain's not working as well as it normally does. But what's the next steps after this rules hearing? When will people be able to go to these promulgated rules and know, how to proceed with starting their cultivation business?
Great question, Chris. So some of that depends on how much comment is received. What occurs after the rule hearing is the hearing officer then takes the entire compilation of public comment, both verbal and written, and essentially creates a report. which will be made public. And then from that point, for example, if the hearing officer says the only changes in it are, you accidentally put a couple of extra numbers or transpose some letters, then we would make those minor fixes and promulgate the rules. I anticipate it'll be a little bit more than that because there are a lot of very passionate people, and we're going to have ideas that will come up that may not have been thought of or brought up in committee meetings before. So with those, then we'll look at them, we'll consider them. Do they fit within the processes? Do we need to make adjustments? If there are a few adjustments, but not items that are made to be major, then what can happen is then the rules are promulgated at that point. But that process depends a lot upon how long it takes the hearing officer to go through them. And so it could take the hearing officer, depending on the volume, a week, 2 weeks, 3 weeks. We don't have, and we won't know the answer to that until they give us an ETA. But as soon as we have information regarding that, then we'll be able to move forward with letting people know. Once we get that from the hearing officer, and if there are no major changes, then what occurs is we have to publish it in the register, the rules themselves. And once they're published at that point, that publication becomes the promulgation of the rules. And so that promulgation then will mean they're in effect. Once they are in effect, the department, as part of it, needs to ensure that we have the applications up and available so that anybody who is looking at cultivation or testing will be able to apply. And the deadlines and dates as far as that application, we anticipate the initial ones, to receive those initial ones within that first month. There's not going to be a due date per se for applications with regard to either of those categories. What it really would just be is we may have a best to apply by for best consideration or early consideration, because what our goal is to ensure that we have enough cultivation for those initial patients by December, and the same with regard to testing. And so we will continue to process applications, but the more that we get in, the longer that's going to take to go through them all. Now, unlike some other programs that have happened in the past, including cannabis, where it was a situation where we would open the block up for a period of time, say a month or 2 months, receive applications, and then once we applications as a block, they would be reviewed and considered. This process is very different. It will be done as applications come in, they will be reviewed, and information sent back to the applicant. And so it's not going to be done as a block, it's going to be done as applications are received. Now, one thing just to make sure everybody is clear, if individuals think that, oh, well, I'm not sure if it's a full application, so I'll just submit it, that's going to delay it, because what will happen is we won't return it as incomplete. And then if the resubmission date is going to be the date that we do it, that we review again, and we'll have to do a full review. And in those kinds of cases, that actually will simply delay the process. So you'll want to make sure anybody who is applying that they apply as completely as possible once they're reviewing the application. And the requirements for the application really are in the rules. So none of that will be a surprise. What we just have to set up is we have to set up, and we'll be working on it, the actual application process itself. And because we'll have them submitted electronically. So we have to get all of those pieces set up initially. And so that'll just take that. We anticipate opening that up within a few weeks after the promulgation. That'll also give some organizations and people time to gather all their information so that they're ready to submit once we have the application open. Does that help? Oh, Chris, you're on mute.
I think that clears it. I think that clears it up quite well.
But I would like to ask if there's any questions from other people attending. Okay, I can't be that good that I'm actually like answering all the questions as they come through. Thank you, Denali. I appreciate it.
All right. And Denali, I have anything your mic.
Hi, thank you, Dominic. I guess my question is, who makes the determination of the threshold of whether the breadth of amendments needs to restart the rulemaking clock?
That's a great question, Denali, and really it will depend upon the volume and how many changes actually occur. There's not a set amount of changes, for example, with regard to it. And so it is something that the hearing officer does provide recommendations, where they'll recommend, there are a lot of changes that need to happen, for example, and I recommend that another rule hearing occur, or that these are fairly minor changes and can move forward.
Thank you. That's helpful.
All right. And James, you can unmute when ready.
Dominic, just two questions on this one. Fees, are you guys thinking of what is the cost for the initial certification? And also, what is your thoughts and plan around that recertification and fees with that? Thank you so much.
Thank you, James. If you mean as far as for cultivation and with regard to testing, part of it will be based upon just the compliance portions of the rule, which really are, there'll be site inspections, additional documents being required at various points, but really ensuring that we're continuing to move forward in a safe and in a way that is actually consistent with the rule. As far as recertification, it's not a recertification per se, or in this case, a permit actually, because those both the labs and the cultivators would be issued permits on that. And as far as fees, so when medical cannabis, as an example, first started, our fees with regard, and actually still are, because that program was funded at that time through the fees. And so it had to be self-funding. That's very similar to what Oregon has had to do. But because we were able to show and actually talk with the legislators in advance about the issues Oregon had, for example, with being able to be self-sustaining, and the issues that we had with regard to medical cannabis in the early years, what we were able to do is receive that allocation from the legislature. And so the program itself is not utilizing fees for the applications, for the permits. So I hope that helps clear that up. And again, I should say that's because the program is funded through the legislature, not having to be self-funding.
Excellent. I don't see any other hands on that, so I do have at least one more question. So we get our initial rules out on propagation, and our cultivators and our labs begin applying for permits, and then our next set of rules comes in and we start changing definitions and stuff like that, and we'll continue to kind of go through this process in a repeating cycle, correct?
Correct. And so, for example, this set with the cultivation and the laboratories is the first set of rules. The next set will be with regard to the practitioners, clinicians, providers, and administration. And then the next set after that will be with regard to locations. So we're doing this in a phased approach. Once that portion is done, then as the program is rolling out, and if there are any concerns or any issues, then at that time we'll continue to initiate rulemaking, and in this case, rule amendment hearings, so that we can ensure that things are covered and that anything that we miss is added on in. Now, the other aspect of it is, say we finish with the thing, it gets promulgated for the cultivation and testing, and while we're in the process of the rules for the education and administration pieces, somebody brings up a piece that was missed or a small amendment, for example, to a definition that is specific to cultivation, then during that rule hearing and that rulemaking process, we can still amend this. So those other two proposed hearing sessions that we're already talking about, although we don't have dates and exact timelines yet, we can actually make adjustments to this rule during those as well. And the same as we move forward. So if during the education one after that, shortly thereafter for education and administration, we find there are a few changes that need to be made, that can happen during the portion about the locations. The other piece that will fit into this is, of course, and it's an important part, is the equity fund. And that could fit into either of the next set of rule hearings. And we'll see what happens as far as the equity committee and some of those requests as far as sorry, everybody, it has been a very busy and long day. But with the equity fund, it'll be about what those requirements will be and how that's going to be able to be dispersed. And so that could fit into either of those others, or potentially if that becomes very complex, rule hearing as well. But that again will depend on in the other areas that we've already mentioned.
Thank you, Dominic. I think you answered my next question in there too. And so it sounds like this is going to be a continually evolving program, and even a couple years down the road, we see something's not working well, we can come back and try to make amendments to those rules.
And thank you, Chris. Just with regard to that, even after this set of rule hearings that I've sort of outlined are completed, we anticipate over that next year to 2 years that there will be additional rule hearings because there will be other ideas or thoughts. Or as we've even talked about, the idea that by December we have this so that the first patients can be seen by December, there may be other aspects that whether due to complexity or additional research that's needed, may not be ready to be added in yet by December. But in order to expand the program and more fully implement it, we may have additional rule hearings over that next span of time, as well as anything that may have been missed or changes that we need to do.
Excellent. Let's go to Gregory. I do have a comment or a question.
All right, and you can unmute when you're ready.
There we go. Chris, I just want to say I could use a solid 5 minutes of your opening 30 seconds on a day like this. So thank you so much for bringing that type of, just bringing that to the way that this is happening. It means a lot to me. I just wanted to clarify really quick on the arc that you covered, Dr. Zerlo, if there are sections of this that are clearly areas that we have not discussed, such as traceability, and we know that that is future development. Like, I'm assuming that we'll have those sections covered, or are those planned to be like lumped into, like you said, other hearings, or would that be just something that we kind of like plan to have in place appropriately in the overarching schedule?
Well, areas that haven't been discussed would be there, but the traceability aspect was brought up in the propagation meeting that it needed to be there. And we did model that on standard industry practices with regard to natural medicines to ensure that the traceability is occurring correctly. But yes, if there are adjustments that need to be made, then that can occur. Whether it be collapsing or expanding, going into more detail regarding it, absolutely can happen.
Copy that. So we understand that there's some level of placeholder.
Yes, exactly.
Okay. Cool. Love that. Thanks.
And just to note, some people, I may have misspoke slightly. The public hearing, the link for that, which is in the notice for hearing, it's not, you don't need to actually register in advance. That's a link where you just show up on it. So my apologies if I created confusion on that. I'm so used to our committee meetings and our board meetings where you do have to register in advance. So that is my mistake, and I misspoke on that. So sorry if I created confusion on it. That link is already in that notice for hearing, and just on the day, on the 24th at 9 o'clock, you can just go and log in. So the information for logging in is there.
Dominic,
Yes,
sorry
Kathy.
to contradict that, but it does look
Oh.
like it's a registration is requested, and I'm guessing the reason why is because of public
Oh.
comment. You need to have the public comments associated with a person if they're
Ah.
joining hybrid online.
My apologies then. Okay, I was correct originally then. Thank you. Thank you for correcting my miscorrection.
I just happen to be looking at it right now and adding it to, apparently it's a little bit hard to find, and so I'm adding it to our meetings page right now.
Okay, thank you, Kathy.
Mm-hmm.
Just to let everybody know,
excellent.
Kathy is one of our team members who is our project manager when it comes to IT items, and is absolutely phenomenal. So thank you, Kathy. And Johnny was also working with her offline. And those who have not met Johnny before, Johnny is one of our analysts and is absolutely phenomenal, and has been the main reason why we've been able to have all of the different meetings that we have. He arranges everything and really helps. So I just want to give them both shout outs.
Absolutely. Thanks for everybody that does all kinds of work behind the scenes. And so did I have it right, Kathy, that you're going to put it on the meetings website along the side of the board meetings and
It is, it's right up
meetings?
top, and I just saved it, so it should be there now.
Thank you very much. That's
You're
excellent.
welcome.
All right. Does anybody have any other questions about the process before we kind of dig into or let people talk about concerns they have with the proposed rules? All right. Well, then I think we'll go into that section of it. Denali, did you want us to begin?
Chris, just before you start though, I do want to be clear with everybody here. Have comments for it. While we're glad to listen to them, they do have to be submitted, and I will put that on in the chat. Be submitted through the formal process, because the rule hearing itself is a formal process. So while we're glad to hear them and even start to consider some of the comments that are made, for them to be on record, while it's great to do it in this meeting, they do have to go to that specific email address. And again, I'll put that information in the chat here in just a minute. We just want to make sure that's clear, so that that nobody thinks that, oh, by bringing it up in this meeting, it will be a part of the public comment of the rule hearing. That is not the case. It will be a part of the public comment for this meeting, but not for the rule itself. So please make sure, if you do have those changes that you want to submit that way, send them to us. And just to let everybody know, on the written comments, it's better to do it earlier, because if it is something then that we do change, we can announce it in the beginning of the rule hearing and it's already in place. So if that's the case, please send it to us in the next couple of business days. Anyway, sorry, Chris. I just wanted to make sure to make sure everybody doesn't miss out because they think this is okay, to just say it here and not be not at the meeting.
No, I appreciate that. And I also, I guess, should mention my intent for this meeting was for us to kind of bring some of our issues up collectively so that we can, advocate for them with a united voice. And the more of us that speak out in that rules hearing, the more, I think the more likely there will be to make major changes to anything that, we think needs to happen. So that's my intention for this next section of what we have going on. So again, Denali, did you want to start us off, or you want me to go to somebody else?
Yeah, Chris, I'm happy to, and really grateful to you and to the subcommittee. I think it's, right, as we just laid out, really helpful to have both a public hearing opportunity, but the engagement of the subcommittees in that hearing process. And so I think you're doing a great job of modeling that back and forth. So grateful also to the department for committing to community feedback in the regulatory process. And the feedback that we have offered, I should introduce myself again, but my name's Denali Wilson. I am a lawyer and a policy advocate. I'm based in Las Cruces, but I'm also the director of strategic support for the Healing Advocacy Fund, which is a nonprofit that supports state-regulated access to psilocybin-assisted therapy. And yes, so our perspective, Healing Advocacy Fund's feedback that we've offered, and that, you know, I'm happy to outline here for the subcommittee, is really foundational. You know, parts of the regulations that are defining who can operate and how. And I'm really grateful for the recognition that this is an iterative process, and that you know, we'll be able to some of the details, the finer details of the program will emerge through you know, what is likely to be years of programmatic development through ongoing rulemaking. And it is really critical that for the viability of the program, that early on we get some of those foundational questions right. So that primarily, right, how can we create strong and protective foundational components of who can operate in order to have the program have a healthy start. So we have offered feedback on the draft propagation rules in 4 primary areas that really maybe move to 3 if we understand that, as Dominic, you were saying, the definition section is really just a placeholder, but I will talk about those sections. So the first is predatory financing and disguised control. And I'm really grateful that the department is prioritizing this and also willing to consider recommendations on how to improve the protections. As a state, we have just such a tremendously long history of extractive economic arrangements that have hurt our communities and hurt public health. And I think we all share an interest in ensuring that this space remain one of healing and not just another place where outside money and interests come in and take advantage of our people and our resources. The draft regulations as written attempt to address predatory financing by pretty broadly restricting ownership arrangements and transfer of control. And the approach is a little too broad in ways that I think will unintentionally prohibit what are beneficial, legitimate, non-predatory financing arrangements. For example, friends and family investments. And we really think that the solution is not to restrict investments broadly, but to instead distinguish clearly and regulate differently those who exercise actual control over a permitted business and those who have instead, you know, a passive financial interest. So we've offered suggestions that reframe this part, you know, the predatory financing and disguised control parts of the code around that distinction in order to strengthen protections for permittees and the program from people who would be bad faith actors while preserving access to what is a very limited capital pool in this space. So that's kind of the first area of our feedback and concerns. There are some other related investment rules and transfer restrictions that we provided feedback on as well. Under the current draft regulations, it's a little unclear whether a party could, and if so, how. They may invest in a permittee without assuming the responsibility for compliance and the actions of a permittee, and that lack of because there's a lack of, in this space, traditional investment vehicles like banks and traditional financing options, the lack of clarity of how one would invest without taking on the responsibility for compliance may unnecessarily lock out needed capital. Again, the example that I'm using is friends and family investments. And I don't think that's really our intention. So additionally, the permit transfer ban in the program, it creates some compliance gap and liability concerns. Just as an example, I think this is the concern is most poignant if we think about spouses, children, other people who would be left in possession of a Schedule I substance cultivation facility with no legal permit in the case of a permit holder's death. So when a permit holder dies, their legal interest is going to in the permitted business, including our cultivation facilities and contents, are going to pass to their estate, to heirs, survivors. All of that happens under ordinary state law. But under the permit transfer ban, those people, spouses, children, family members, may find themselves suddenly in possession of and without any legal responsibility, with the legal responsibility for a facility that's actively cultivating psilocybin mushrooms, and now they don't have a valid permit. So under the draft regulations as written, because there is a ban on permit transfers, there also is no mechanism for that person to obtain authorization to maintain or wind down or transfer the operation. So they can't legally continue to operate. So to address that and other transfer concerns, we have offered to the department some clarifying amendments to avoid that kind of unnecessary hardship. So those are two areas. More broadly, there are some other parts that we've talked about, I think, more in this subcommittee, equity and access issues. I'm going to come back to the issue I've talked about from committee to committee, hearing the landlord attestation issue. And I want to start by saying something that I think I'm still, relatively new to this space, but one of the things that, I don't think that I've recognized in this space and deserves recognition and acknowledgement is that New Mexico was the first state to allow for non-property owners to operate in the cannabis industry in the whole country. And that was an incredibly tremendous shift in equity and access in the cannabis space. And I think we should be really proud that we were the first to model that. And I think that it's really Dominic who we have to thank for that. And it created new challenges, right? And we're working on figuring out how to address those challenges. But it's tremendously important that we have modeled that, you shouldn't have to be a property owner to operate in this space. And we want to figure out how to protect tenants who do choose to participate. And so under the current draft, landlords would be required to produce, or a tenant would have to ask their landlord to produce an attestation that allows them to cultivate psilocybin in the facility. And the challenge is that landlords, even those who are supportive of their tenants in the program, are really unlikely to provide written approval to engage in conduct that remains federally illegal on their premises. And so really, when it comes down to it, an attestation like that would be a written proof in a legally binding document of aiding and abetting in the manufacture of Schedule I substances, which exposes the landlord to civil and criminal liability. The requirement also could, if our goal is to protect tenants, we have to recognize that this kind of attestation requirement could also create an opening for exploitation, where landlords who understand that their written approval is required for their tenant to engage in this program, may use it as leverage to extract unfair terms or higher rent from tenants. And so we think that the solution is to add a lease option. And that lease option can specifically can specify that the lease must protect a tenant cultivator's right to operate in the program. It may even be a good opportunity for the department to include model lease language, like an anti-liability, or what is it called? Anti-illegality waiver. That we'd be happy to take a stab at drafting with the department to make available, right? And then the department is in a position to say, okay, this level of protection or higher, right? But it just to model what is expected. And then make similar amendments, necessary amendments to the attestation option. So instead of attesting to the cultivation of a Schedule I substance, permitting that happen, right? Instead, the attestation option should be for participation in a DOH program or something a little more innocuous. And just to wrap up, the other area of feedback that we have offered to the department is around some insurance issues, both for care coverage and professional liability coverage. These concerns really are almost exclusively tied to the definition section. And so I understand and appreciate that those that should be held for the appropriate regulations when they start to actually come into play. And so I'm looking forward to working with the department when those pieces are revived, and we can really work on making sure we get it right.
Thanks, Denali. That was awesome. Is there a way that people, I have your write-up, and I feel like a lot of people may have a hard time tracking all of that if they want to make public comment around it. Is there a way that people could also get a copy of the write-up from you? Is there
Yeah. I might ask, let's see. So we did meet with the department yesterday and wanted to make some, after that conversation, clarifications, especially around the pieces that we understand are, really being held for future rulemaking. So what I could do is when we make those amendments and then share it as the official public written comment, I know it'll be made available through the department, but maybe there's a way to share it directly through the subcommittee. I'm saying it with this inflection as a question because maybe someone can tell me whether that's possible.
Johnny, can we, if she emails us something, can we send that out as part of to the registrants?
Yeah,
That
I can email to everybody registered for this meeting.
Is that what you were asking, Denali?
Yeah, perfect.
Okay, cool.
So I'll make the changes that that we talked about, and then I will send it to you and to Johnny. Is that right?
Mm-hmm.
Yes, please.
Okay, awesome. And to the official thing, because it's not official until I do that. Okay.
Yes.
Thank you, Denali. I know you have a comment, Greg. I heard you try to get in there, but James Brown has had his hand up for a while, so I'm going to go to him real quick, and then I'm going to cut to you. Anyway, James.
Thank you, Chris. Just real quick on my end, it's around that dual ownership. Can you guys explain and just expand on that so that I can extrapolate my opinion and submit something? As far as that goes, are you saying one permittee for each business, or the permittee can own both of those types of businesses as far as being a producer and a laboratory if they wanted to be. And again, would that licensee or permittee, sorry, be restricted if they wanted to be either a facilitator, a guide, something else as far as a practitioner or any other permit that was required through the DOH process? Thank you.
Just for clarification, I think you're talking about section 735.2.9, the general permittee requirements, dual ownership prohibited. Is that what you're talking about, James?
Exactly, Chris. Just right in there. Thank you.
Do you want to talk about that, Dominic, or I feel like I can take this on too?
Let me take a shot at it. So, James, the way the rules are written currently and is essentially that there is not dual ownership allowed. And a lot of that is due to conflict of interest. That is actually one of the lessons learned that we have had from other programs, and that it creates potential issues and concerns. For example, you don't want the same person cultivating or the same entity cultivating and then testing. And because then what happens and how much more difficult does it become to track down if, for example, there are falsified or adulterated tests and things like that. Similar with regard to the same individuals offering the administration and someone who is cultivating or again even testing, that creates a lot of conflicts of interest. What Denali and team are suggesting, and which our legal team is looking at, is that in some of the ownership, so the permits would still could only go to the one and no dual ownership in that regard, but that in order to allow for some more flexible investing, and especially for startups, because we recognize, similar as with cannabis, because of the Schedule 1 status, that you can't get loans or or items through banks, and many private investors say absolutely not in that regard, that where you might be able to get investors who are willing to invest and help with the startup money, and that may actually be involved with regard to permitting, that you could still invest to a small amount and so still help with some of those other entities and those other permits, but they still would not be able to have controlling interest, decision making, those sort of things, those sort of aspects. And Denali, please correct me if I'm explaining this either too broad and generally, or if I missed the boat. But that's my understanding at this point. Is that correct, Denali?
Yeah, well, and I think you've captured it really well. Really, what we recommended, and this goes back to what I was saying about distinguishing between two different classes of sorry, how did I say it? Tiers of ownership and control. And so if we distinguish instead between those who exercise actual control over a permanent business and those who have, more passive financial interests, what we've recommended is an inclusion of a definition of a true party in interest, which is something that exists in other spaces that we can look to. That's really what we're talking about. We're talking about actual control over a business that could be used to unfairly influence the market. And I think when it comes to dual ownership, the recommendation would be, okay, you can't be a true party in interest in two separate entities, but you could, as you just put it, Dominic, be a minority investor in more than one.
Does that answer your question, James?
Yeah, Chris, just one thing is with that just kind of limits business. I was in the brewery business and I've been in pharmacy business for a long time. And some of this is going to restrict, you're causing some choke points here. And I just think that that's something for us to come up with some comments on. And I mean, it might be just a hard stop there, which is fine. I just wanted to know, if you're rural, let's say you're one of these little communities like Farmington, there might only be one person or one group that will be able to provide these services, even from a growing point. If they want to be able to do that locally, it would have to be somebody completely different. And so I just, like, as a nonprofit, I just think it restricts some of that. That's all. Thank you.
Yeah, and I know we've heard similar comments in the past, but I tend to agree with Dominic on this one, that the conflict of interest kind of outweighs some of that. And also, a lot of people are going to be in the same boats where they have to drive to get their products tested, or they're going to have to drive to get uh, their um, product long distances. And so that's just going to be part of running a program in rural areas. And we've done a lot to try to minimize the effects of that throughout this process. So go ahead, Dominic.
Yeah, thank you, Chris. And sort of answer that as well, James, is that's also a part of where the Equity and Access Fund comes into play, which wasn't something that was available in some of the former programs. And so having part of the idea on that is to help minimize those potential issues, especially in rural frontier areas. And so there may be other ways to assist that doesn't create that conflict of interest. And so those are parts of what will be being looked at, especially with regard to the equity piece. So I hope that helps as well.
All right. Any further comment on that section? I want to thank Denali and Victoria Sintanovic for coming up with those amazing rules. And I noticed one thing that we discussed a lot in propagation that's absent is the sunset clause. I got to bring this up, and it, from meetings with Chris Woodward, it's I think that was a stretch from the beginning to get that put in there, but after speaking with Victoria about some of the predatory financing laws that she wants to implement with the Department of Health here, she assured me that, it's going to go a long way to protect our local community. And she's very sharp, and I trust her on that. I'm not a lawyer, so I, I really can't speak to the efficacy, but she's both her and Denali are working really hard to protect our local cultivators and testers and everybody involved in this program. So I want to thank you both very much for all the support on that. All right. Next up, I also want to thank Gregory Evans, for coming to just about every committee meeting, I think, and being involved in every aspect of this program. You're amazing, sir. And would you like some time to talk about what you see here? Did we lose him?
No, I'm here. Thank you.
Oh.
Yeah. Yeah. I want to be as thorough as possible without boring everybody to death. I think the first thing I'm going to do here is, considering I have a fairly robust analysis, and I've made a 3-page and a 16-page printout version. The 3-page is just high level what we're looking at without the arguments and the reasons behind things. And then the 16-page kind of covers some of the more nuanced why am I recommending this? Does it go back to this decision made in this specific meeting? This is what was voted on by the advisory board or whatever. Just my primary goal is to get this document in alignment with the vision of the committee and the board, understanding that much of this needs to be sanity checked through layers of review, government, and ideally, when we get to this section, actually a biochemist and some scientists that are experts in some of the testing stuff. So from a high level, I wanted to just kind of get some feedback. Do you guys want me to just burn through a list of everything that I've got here? I have around 29, I have exactly 29 recommendations. A good chunk of those are definitions set in 3 categories. But I just wanted to know, do you want me to just run through it, or do you want me to go into detail on the sections as I go through?
How about we run through it, and could this also be something that we could attach to that same email, Johnny?
Yeah, sure.
Okay, and
Yeah.
then we can attach your document to it, and that way, if people want to do the deep dive, they can kind of go into it on their own. Does that sound good, Greg?
Yeah, anyone who wants to see the actual detailed language that is not behind a firewall can click the link. It's a public website. Anybody can view that. And then I'll polish up the shortened PDFs for like official submission. Hopefully today or tomorrow, and get those
Excellent.
to you.
So did you include the link on the chat for people to do the deep dive?
I forgot to press send.
Okay.
I'm really exhausted.
Thank you.
Is it possible for me to share, or is it better for me to just talk?
Yeah, can we let him share, Johnny? If he wants to show a screen.
Let's see. Okay, let's see. Do you have the option up by the mic?
Yep.
Do you see the share thing? Okay, cool.
Yeah, 1 second.
And just as a reminder, Greg, since you don't usually have that capacity, whatever you do, do not click on the yellow end event button that's next to share. If that does happen, the meeting is over, and we're not able to rejoin. So please do not do that.
Thank you very much. Unfortunately, I'm in way too many Teams meetings for the Department of Public Safety, and I'm seeing it happen. Let's see. I'm gonna constrain this to just this window. I think this is it. So let's see if I can do this. I'm still figuring this program out, but it's pretty great when it works. This is a working draft, yada, yada, yada. Some stuff about who I am, why we're doing this. This is really comment. All these comments are to align the document with the intention of the committees. And then there are a few things where we need to do some sanity around some science. So under definitions, I have 3 sections: the amendments, the gaps, and then the stuff that we don't need. I think the stuff we don't need is pretty well known. So we don't really need to spend any time in there. So just running through it really quick, the definition of inoculate is obscenely incorrect, and I have provided a suggestion down here that states inoculate means the process of introducing spores, mycelium, or spawn into growth medium. The definition of psilocybin, based on several factors of how the rule is written, should be broken out to include psilocin. Whereas, and you can remove the chemical weights, but it's might be worth having them in there. But essentially it just breaks those two apart. Cultivation, manufacture definitions. This was something that took me a while to kind of like wrap my head around. But based on all of the conversations that we had and the nature of the final product and the pathway to get there, the recommendation that I have is to define cultivation as the means of inoculation, growing, maintenance of psilocybin producing mushrooms through harvest. Process would carry you from drying, homogenization, or preparing processed material for storage. And then manufacture would be putting it into sachets or capsules. There's quite a bit of reasoning in here to go over, but I'll skip through that unless anybody wants me to come back. I do think that
One
the committee
second,
should.
Greg.
Yeah.
Can you enlarge your text? I have it on my side screen, but there's no way I can see it on my own. So I'm fairly sure if other people are following along, they might not be able to see it. There we go. That's better. Thank you.
Thank you for asking. Like, I would love nothing more for this presentation to go full screen, but I've tried everything. I would like to come back to the committee for consensus on defining if we should remove the term convert, because the term convert insinuates a process of extraction, and all of the other processes that we require for this specific format of the program are covered with these three definitions. So, moving on. There was a lot of artifacts from whoever copied and pasted this from the cannabis terminology that didn't clear the term lot. So there's a fairly exhaustive mapping of how that needs to be cleaned up later on here. But essentially, the recommendation is to strike 7H5. The homogenization requirement is resolved by the amendment or the amended batch definition, see item 8 on C7C, which specifies batches must be fully homogenized prior to testing. On potency, there's a little bit of confusion in how that was written, and I think it would be more accurate to say potency means concentration of psilocybin in analytes specified in table 2 of 19G in a sample of a batch, lot, or see, we need to clear that lot or product measured and expressed in milligrams per gram. And this kind of ties back to that conversation about concentration potency being locked into psilocybin, and then later in the like psilocybin equivalency, and then later, and I think this might actually still need some work, but defining that the psilocin equivalency can be included on those labels, but like the cornerstone is the singular psilocybin equivalency measurement, and defining how that is measured is something that we may still need to get into the weeds about, but not necessarily today. The definition of mycelium was wrong, and I've corrected it. Mycelium means the vegetative body of a fungus composed of a network of filamentous structure called hyphae. If you want definition of why it's wrong, that's there. And then this is why we should consider adopting different language. I'm open to interpretation, but this is scientifically incorrect. Fruiting bodies, definition. Same issue here. Correct, a better or more correct definition would be spore-bearing reproductive structures of a fungus, including the cap, stem, and associated tissues. Lot hierarchy, replaced with batch as a single production unit. As we discussed ad nauseum during the committees, this is how I want to map this structure out. We got all these definitions. Definition of the problem. Basically, the term lot does not appear anywhere in the adopted propagation outline. We're moving to batch based on scope of production. If we were producing thousands of pounds at a time, we would have to separate lot and batch. But the mapping and downstream sections of how those corrections would need to be adopted if this was, or need to be adjusted if this logic was fully adopted into this document, are mapped out here. It has every instance of lot and how it should be corrected to reflect back to the term batch. Batch also was, I think, I'm not sure if I passed it, but batch wasn't defined as 1 kilogram as discussed. And so I've included that in here as well. With the 4-week window of harvest cycles. So the official recommendation is to strike convert here.
Hey, Greg.
Yeah, sorry if I'm getting lost.
No, I just want to ask Dominic one question. Is there a reason we brought the term lot into this? Because I don't remember ever talking about it or having a need for it either.
Yeah, it actually is as part of the normal rule process. If you have everything all as batch, it ends up actually being extraordinarily confusing because there are different stages. And so it's really just designating and determining at what stage of the process it is. And that's why the batch is at that particular point and the lots actually fit with regard to especially homogenization. That's really where that is. And then product lot is a regular term that is utilized within industries, various industries, when you have product lots. And so that's just why that particular one is there. To be honest, if we could have utilized even a different term to distinguish between those different stages, that would have been even better, quite frankly. But making it all just batch would then mean that everything would fit under that batch definition, which makes it very difficult, and you wouldn't be able to actually distinguish which batches, what exactly does batch mean without having it all separated out into different definitions anyway. And a lot of that is just semantics and not necessarily part of it. But I will address the one part about the 1,000, I'm sorry, the kilogram aspect. The reason that wasn't included under the actual batch item, the 1 kilogram cap, is because that was done for the testing purposes, which was the main discussion. And as we were talking with the various laboratories and other areas with regard to it, that was part of that suggestion. So we did keep that as far as the spirit and the intent behind having that limitation on the batch. It's just actually not included in the definition, but in the sample size.
Okay. Thank you, Dominic. I'm just wanting to be clear so that way we're, if I advocate for this, I know what I'm advocating for. And
yeah, same. And I think that's new information for me as well. So thank you for walking through that.
Absolutely, my pleasure.
Just off the cuff, it might be if we have to use lot, like if a batch is a single inoculation of a product across multiple whatever containers, and a batch is all of the harvests over the course of 4 weeks, a single flush could represent, so a single flush's harvest could represent a lot. And then you could homogenize that lot and then get 4 lots in a month or whatever and combine those up together as a batch. But I also think that for testing purposes, like the more product we batch together in a single testing event, the greater our consistency across known dosing variables will be. So I don't know if there's even time to really get into that, but trying to stay out of the weeds on that today. But I'll probably do some rewriting on this.
Oh, thanks, Greg.
Yeah, totally. And then that covers all of the adjustments that I had marked. And then there are 4 gaps that I wanted to identify. We refer to spawn all over the document. So we need to define spawn. Spawn is substrate material colonized by mycelium that is used as an inoculant to initiate mushroom cultivation in bulk growth medium. That is very important to have as a definition because of what's written here. Next, we do not define certificate of analysis. I don't know if that was intentional, but if you wanted to include the definition for the purposes of this program, this is the text that I would recommend. We do not have a definition for shelf life or stability, and I'm kind of like either or. You know, there could be value in having it and value in not having it. There's some level of ambiguity that, like, if we have stability and shelf life tied to variables like our retesting cadence that end up shifting, it just means a lot of things that we have to cascade, changing, cascading. Yeah. I mentioned I'm exhausted. And then items to defer, just I'll just scan through these. I think if any of these aren't already known, I'd be surprised. But yeah, that's the end of definitions. Now for the fun stuff. How are we feeling? Okay. I did a lot of thinking about sample size. The initial recommendation is that we lock it to 1 to 5 grams after looking at some of the analytes that were introduced per the recommendation or per the document that we're reviewing that were not expected analyte requirements. I think that the logic would be much better to defer to the SOPs of the testing facilities. And then if we need to constrain the rules around, you know, like I think we have a pretty good coverage of control on approving those SOPs. So if we trust the testing facilities, I don't think deferring that amount to them is outside of reason. There is a potential based on increased testing panels requested below, which we'll look at next, that it could be up to 1 to 10% or like 1 to 10 grams, depending on how many like hydration tests and other fungal panels and other bacteria stuff that's included. So we'll get into those details below. But I put this definition together in hopes of like containing the spirit of what the intended goal of the committee was. Now for the fun words. let's see if I can pull up the. I don't want to bore everybody with science. The document's available to read. But there are a lot of things being required by this in testing that could push individual testing instances well over $2,000. I feel like I want to be very respectful to the people who put this document together, but I don't think enough attention was put on this, and I don't think it was reviewed by a mycologist or anybody who anyways, I don't want to. I had a lot of I spent a lot of time researching this and getting to the details, and all of this has full review documentation with bibliographies if anybody's interested in seeing any of that. The 4 organisms that should be removed from routine testing are Shiga toxin, or Shiga toxin producing E. coli, which is different than most of the E. coli's that we test for in a standard panel. Clostridium botulinum, Pseudomonas aeruginosa, and trichoderma. Trichoderma is not a human pathogen, and it's commonly found in fungal. It's going to be there. So this would kill all good number of tests, wouldn't allow things to market. There's a bunch of stuff in here that would block product to market. That's probably one of the least impactful ones, but it's just, it doesn't need to be in there. So I would recommend adding to the provision to not require testing for Shiga toxin, E. coli, Clostridium botulinum, and Pseudomonas aeruginosa, trichoderma, Aspergillus niger, Aspergillus terreus. The 2 Aspergillus could be triggered for quality control testing if the department felt like they really needed to include them at some level. But overall, if anybody has the patience to read all this stuff, it boils down to unnecessary testing, high cost with low reward. And if we're just trying to flex that we're testing a lot, I think that this price tag that could potentially even be doubled based on further panels that we'll discuss is a bit absurd. And I do have a full document breaking down the cost analysis of all of this. 19E, yeast mold threshold. 20 CFUs is literally unachievable for dried fungal products. It's unprecedented. And the only reason I can see that this would ever be here is if somebody forgot a comma and 3 zeros. There's absolutely no world in which testing for yeast and mold at sub 20 CFU is passable. Literally, mold is fungus. So it just doesn't make sense. All these details are too many words for me to go through right now, but I'll get to recommendation. Amend the table, adjust the CFU to 100,000 CFU per gram, which matches most states' cannabis, whereas New Mexico's cannabis is at 1,000, which is a wonderful barrier for that product, where you are inhaling that product after it's been combusted. Whereas these types of materials that we're testing for don't have nearly the same impact on a gut biome. If I'm being very honest, the actual barrier could be 100 billion parts and it would still be safe. Just considering the context of what we're testing and why we're testing that. I don't want to bore everybody. I'm sure most people are asleep and I'm running way long. Almost there. The detail on aspergillus reporting. The document requires binary detection. The easiest way to walk through this is to just say, like, those are not things we need to be testing for. Some of these tests look like they came from like canned food testing rather than something that is related to the product that we're discussing. The binary action result, this is a test that will probably prevent 90% of produced materials from making it to market. That's a very rough, off the cuff. I don't have a document to defend the 90%, but this would get in the way of a lot of product making it to market. It'd be a huge strain on producers and the entire system. Moving on, done with all the bacteria and stuff. Residual solvents. I recommend we remove this because of the scope of our program. Doesn't allow for any type of extractions. Therefore, there wouldn't be any residual solvents left to test for. If we're trying to prevent edge cases where people are doing nefarious things, I think we would need to approach that from a different perspective rather than providing a burden on all producers. I'm glad I don't have to read this whole thing. Whew. This is an interesting one. Water content testing. I would encourage the department to kind of read through this in depth, because this was kind of this one triggered some learning for me and some deep thought on potency and viability over time. And Chris, again, like, please interrupt me if I'm taking too much time.
I think we're still good. Where are you at here? Let me look at your
I think I can
document.
wrap it.
You,
I think
you,
I can
you got a
wrap
couple
in
more
5.
pages. Yeah. You're good.
Yeah, the last 5 pages are mostly blank. Okay, so water content shall be determined by the loss on drying and shall not be exceeded by 10% weight. The water content result expressed as percentage shall not be reported on COA, or shall be reported on the COA. This allows us to track when we trigger retesting, if our potency variance is affected by water hydration variance as opposed to alkaloid degradation. It's an important thing to track. If we insist that our target, we have to test for LOD. Any lab is going to test LOD before they do any sort of analysis anyways. So if we push that drying limit to the lower end of the 8 to 12 range, we will have less risk of degradation over time across the board. We won't know the efficacy of that until we have a year or two of data. Attached to that is the upstream microbial control. So way too many words. Yeah, pardon the pause. Yeah, go ahead.
So I just wanted to ask Dominic if we had reached out to any of the labs in Colorado or Oregon to kind of verify the requirements that we put in and make sure they were kind of in keeping with what we're going for. And not that I don't trust your work, but I always, say trust but verify, right? Like, and if that's something that we should
verify
do.
everything.
Yes, Chris, actually, we have. And some of these items, for example, I would agree with Greg on if it weren't, we are also looking at potential contaminants from growth medium and from sources. And so that's actually why that testing is there. Yes, if everybody did everything in a completely clean, sterilized environment, many of these wouldn't be necessary. However, the reason they're there is to ensure the safety. And this is true for testing with regard to any products, food, other medications, things like that. And remember, this is a medication. So it does have a higher standard than simply looking at it from the food product or item. And so we do have to ensure to keep that. Now, that doesn't mean that we won't continue to look at them. And as we've said, throughout the life cycle of the program, we'll be continuing to look at testing, at measures, and really ensuring that things are going to be done appropriately. And one thing that I want to make sure I mention is that there is within the rule the ability of the program to delay a particular test or set of tests if we do find out as we move forward that it's something that the capacity just isn't there or that it becomes too burdensome. And so that those are all things that we've put in order to ensure that we are still able to have testing so that items are safe, so long as it is done, that things are safe. But if they become too burdensome, that we can reduce that down so long as we ensure it's still safe.
Yeah.
I hope that helps.
Yeah, absolutely. And part of the reason I request or suggesting or offering adding this new provision for controlling the water activity levels is to prevent against those high risk microbials that actually do cause issues. So basically, in lay terms, I'm saying make sure the mushrooms are actually dry. And by actually dry, there's math and proof of that dry, the state of dehydration. And what that will do is it will, where did my words go? Here we go. Setting the threshold at 0.6 places the product below the growth range of every organism of concern in the panel, including xerophilic molds, Aspergillus flavius, aflatoxin, the aflatoxin producer retained in the amended panel. So I think by implementing this, that helps us reduce the risk on the rest of the panel, therefore increasing product quality across the entire program and reducing burden on everybody, honestly. Yeah, leave it there. Retesting cadence, I just kind of went back to, so I believe it was left in at 5 to 6 months. We kind of had that conversation about putting that at 12 months. So if that is really our intention, this is to align the document with the recommendation of the board. If if that was changed intentionally, I'm more than happy to sit in whatever camp needs to be supported. And that's about it. I have some labeling and potency stuff. I'll just let people read through that at will. I will vocalize that I'm not a huge fan of the some of the terminology that's being adopted that was made up. It doesn't feel in line with most industry standards, but the math is there, I'm fine with it. Storage and shelf life, due process, all that. Yeah, that's it. Thank you for putting up with my 35 minutes.
No, thanks for going deep. These are some of the questions we need to ask, and I'll be reading and looking into some of this stuff. So I appreciate it, Greg. Next up, Brett.
Can you kick me off? How do I stop sharing? Get me out of here.
Oh, here
And
I can
push the yellow button, right?
Oh no. Okay. Let's see. There we go. I think. Oh wow, did that still not do it?
No, that did. That's correct. Correct on that.
Oh, okay. Yep.
Yeah,
It just,
and
yeah,
Greg's no
it
longer
took a
sharing.
second on mine.
Yeah.
Cool.
Thank you, Johnny, and thank you, Greg.
Thank you, Johnny. And next up, Brett, did you have anything that you wanted to add that's not been added so far?
Whoops, sorry.
Go ahead, Brett, whenever you're ready.
There we go. Okay, your mic should be enabled now.
Okay, great. Can you guys hear me? Okay, cool. Yeah, thanks a lot. Again to everyone at the Department of Health, Chris, everyone else that contributed. Yeah, Denali had a lot of good stuff. Greg, yeah, incredibly thorough, man. Nice job. And yeah, I know you've been deep in all these. I don't have a ton to add. So my name is Brett Phelps, for those of you that I don't know already. I'm an attorney here in Las Vegas, New Mexico. Have mostly been recently have started working on some of this with the Psychedelic Bar Association. So we don't have any financial interest in this, but that is a group of lawyers across the country that are just interested in these policies and things. So I have been involved with them some lately. I believe we have met with Dominic and some of the DOH people. So I don't have a lot new to add. I did just want to kind of second a few things, mostly around Denali's comments, specifically the actual control and the ownership. I really get what the department is trying to do there, and protecting people and making sure that there's transparency. But I think getting a better understanding of what's considered actual control versus a passive financial investor can satisfy those goals while still allowing these types of financial arrangements that really there's not a lot of places you can go to get financing for these types of these types of endeavors. And so, since you can't go to a bank or get a standard type of business loan, I think, allowing some of these in ways that I think are addressed pretty thoroughly in the document provided by Denali, and some of that. So I won't go into too much detail other than I think, yeah, and we'll provide a more thorough written one as well. But I think getting an idea of what's actual control versus just what's a passive financial investment, and I think they have offered some ways to do that. The dual ownership, I think I totally get the labs, right? Not having people involved in labs and other entities beyond that, I don't think that the conflict of interest is really, I think that's where the main conflict of interest concern arises. And so I think limiting people from being involved in production and laboratories at the same time makes sense. But in other ways, I don't think it necessarily, I don't think the regulations as they are now outweigh the potential benefits of people being able to support multiple businesses. Again, if we have that actual control more clearly defined, then I think that can help eliminate that or allow that to not be the potential conflict of interest. Another big one that we've come across is how we're going to deal with the lease agreements, and the language that I think in the current proposed rule is just going to be really, really tough for people to do. I just don't see a lot of property owners wanting to put down in writing that they are allowing somebody to essentially violate federal law. So I think there may be some other ways around that, or something that can I know how a lot of that happened in the cannabis space when that came on board, and people, I get having that protection in place for the potential permittees, but I think there's maybe a better way that we could look at doing that would not be so restrictive there. Maybe something like language about to participate in licensed Department of Health activities, that type of thing. I think is possible. And then the other kind of big one that's within this purview is the flat out basically ban on the transfer of the licenses. I think Denali brought up a good point of what do you do if somebody passes away and then the license essentially goes away with them, and the people that are left with the infrastructure that don't have a license. Also, I think it's just I think it's going to be a major sort of discouraging to people to get into the industry if they are into this program, if they don't have any kind of real exit plan, right? It's really hard to picture, if you're going to set up and run a business, and you eventually want to get out of that business, to not be able to sell your license is really puts people in a tough bind. So I think on that, not allowing it without department approval, I think would be a way that we can maintain that. I understand the transparency issues and wanting to know what's going on financially with these organizations. But I just see a flat out ban as being, real problematic. And so I think if that's something the department has control over, has approval over, then it would satisfy the concerns that I think the rule is based around, while still allowing that flexibility for business owners and operators. One other one, I know this has been discussed, and it may be kind of a dead issue at this point, but I just wanted to bring it up, is that at this point only the homogenize that the product all has to be homogenized. If we're looking at more of the non-Western traditional medicine applications, if we're looking at more other types of indigenous based practices or ways to provide this medicine, I think allowing the non-homogenized product or medicine to be consumed would really, again, fall under those equity concerns and the big concerns there. So that one, I don't know if the department that they may have already reviewed that and decided that was going to be a no-go, but that was one other thing, because I know we have been trying to figure out how are we going to include as many people to participate in this as possible, who's going to be able to provide the medicine. And I think allowing that open, having other options there, I think is important. those are the big ones. Like I said, I think Denali's written out comments really get into the details of what this could look like, but I just wanted to really second and support the issues that they brought up, and specifically the ones that myself and some of my colleagues with the Psychedelic Bar Association have identified as well. So that's about all I have right now. Again, thanks to all of you guys putting in all this work, and yeah, excited to see where things go next week. So thanks, Chris.
Thank you, Brett. Yeah, I hope eventually we figure out some way to get a waiver or something through for people to engage with the mushroom directly. I was up in Colorado for my training recently in an experiential session, and I did 3 grams of in whole mushroom form, and I was thinking about Matthew A, wherever he is, and several other people that kind of brought that up through the process, and I had a beautiful journey, and I do think that eventually needs to be part of it, but I don't know if it's going to make it in right away. James.
Yeah, I wonder if we could even get them connected. Just to follow up on that, Chris, I think, on the permittee, I can totally agree with a laboratory being a separate permittee than a producer. I just really want the department, you guys, to really consider the thought, again, behind that, sharing that permit with, let's say that you're a retreat, or that now you're a service center, or whatever terminology that we define it as. I just think that you should be able to have the ability to have a production license. And again, there's something spiritually behind that, on that push. I really do think that there's a connection with growing something and having people, it being tested and make certain sources is all controlled and all that. That's fine from a third party, but then bringing it back to that center and then experiencing what you grew. And I think, we're kind of forgetting that. And I just wanted to bring that up as a strong point to say, there's a spiritual side to this that we're kind of forgetting. And I think that would allow us to be one of the two, but also have a center or a retreat or one of those other type of licenses to provide those administrations. Thank you.
Thank you. Does anybody else have any comments or concerns or things that they've seen in the regulations that they want to bring up in this space and allow their peers to consider advocating for? We have Jarvis. Jarvis
All right.
Webster, please introduce yourself and let us know what's on your mind.
Can you hear me?
Yep.
Yeah, okay. I wanted to comment on some of the rulemaking that Gregory Evans was talking about. I'm not sure that I'm clear on what lot and batch means, but the 4 weeks time will not accurately give you 1, 2, 3, or 4 flushes like you were talking about in that. It's more like 8 weeks time. And there's some real concerns with aspergillus because that's black mold. I know that it's somewhat safe in food ingredients, but if there's black mold growing in your spawn and it grows into your mushrooms, it's really dangerous. Some of the other pathogens that you talked about in the stuff you went over are less safe than I guess I disagree. I don't think they're quite as safe as you talked about. There should be a limitation on parts per million for some of those contaminants. I guess that's not a question, it's a comment.
Thank you, Jarvis. Anybody else have anything they want to add? Right. I appreciate all of you bringing your voices to this space, and I will be at the meeting on the 24th, and I'm looking forward to seeing anybody else who joins us there. And looking forward to hearing all your comments, and I know Dominic's going to be there. Are you going to be there, Jorge? Awesome. So at least the 3 of us will be there, and hopefully we get others too.
Well,
So
we will have the hearing officer and the attorney representing the department, Chris Woodward, will be there. So there'll be at least 5 of us in person, Chris. So. But seriously, I echo that. I do hope that other people are there so that they can, one, hear some of the modifications based upon the comments that we already have received, and also to be able to express your own. We want to make sure that this is an open space for people to be able to express their thoughts, their ideas, and so that we can actually ensure that we have the best program possible. So I just want to thank everybody for also bringing some of this up. But, and I put it in the chat again, is if you do want to submit comments, remember, while we're listening to you here and we are taking note of it, it is not official comment on the rules unless it is submitted as required in the notice. And I did put that portion about where you can submit it, either electronically to jacob.clark@doh.nm.gov or the postal address. So thank you, everybody. I appreciate it.
and thank you all. And this is probably the end of the propagation committee. So take care of yourselves, and I appreciate you all, and I'm looking forward to seeing you on the 24th and then the other committees. So
Thank you, everyone.
Thank
Thank you,
you.
everyone.